Hi, my name is Chisengo from Texila American University here at one of the hospitals in Zambia. So here I'm joined by a doctor. He's going to introduce himself and tell us more and what he's studying at the university.
Okay, so I'm Dr. Kuku Kapenda Kapasu, a medical doctor in Zambia, and I'm a family physician currently in my last year at the University of Zambia. But I've had the privilege to be at Texila American University, and I'm in my second year pursuing a master's degree in public health.
So I believe that public health is about preventing disease, prolonging life, and preventing diseases. So how can you determine the skills that you have learned during your studies at Texila and how you will incorporate it in your work?
Well, Texila has brought up a good learning platform that enables many professionals like me who is working in an environment that we work for long hours, especially here in Zambia where the doctor-patient ratio is very high. But I'm able to advance my academics because of Texila's blended online platform. Okay, and during my first year, I've quite got enough knowledge from the program that has helped me actually even help my patients and the nation at large, because primary health care is quite a big thing in the medical facility, and that's where we have quite a number of people that come to the hospital. I think roughly 70 to 80% of everyone who walks in is within the primary care category, aside the specialist training and, or specialist services that most people actually do.
That's nice. So it's also a privilege that we are interviewing someone who's currently at this school.
Sure.
And I just want you to share how Texila American University creates that platform for someone who is working but also studying. Is it manageable?
It is manageable for you to actually acquire different academic qualifications aside just MPH or Masters in Public Health. Reason being is that the blended platform helps you to actually advance your career while seated at home, okay, or in the office. There are many times that sometimes I have a few minutes and hours, just open up my laptop and read a few pages on the provided modules. So that is something that I think every other individual who is not within the region where the university is able to actually acquire the knowledge. Secondly, what I love about Texila is I think they understand the global economics. Things are hard at the moment, and they're able to actually individualize payments that are flexible, that you could pay monthly, quarterly, or even as a semester if you are capable. But that in all gives you the best experience that one could actually have.
That's a very good thing to note. Even our payment plans are something to look for. And looking at the fact that you are a medical doctor, that you pursued a master's in public health, what led you to that decision?
So me getting this paper or the knowledge and skill is actually going to go further and actually have very good quality impact on the patient. And that also brings in some form of satisfaction on you, because as much as we pay for our services, but the patient going home and smiling is one of the greatest payments that one would have.
So how do you find that learning public health help you in being able to network and work with communities, organizations, and accepted social norms and regional cultural contexts?
Well, we've got so many lessons from the COVID-19 and you know, that is in itself public health view that have we been prepared enough? Have we been in a situation where we had a lot of public health specialists? I think maybe we would have handled it well. And it's an encouragement to many people, like I alluded to that in Zambia, and we still have a huge gap if we look at the public health specialists and the population, and therefore not only COVID, but there are many outbreaks, diseases that are coming in that require the public health specialists to be in the forefront. Being also on the preventive side, we have seen a rise in hypertension and diabetes. That also is something that us as future public health specialists need to come in so that we can help our population prevent these non-communicable diseases and also infectious diseases. So in all, we are bringing so much skill to the nation so that we can protect our mothers, our children who are in any part of Zambia.
So can you say that learning at Texila American University has helped you in terms of the communication skills that you have learned at the school in being able to perform and give the best knowledge or information to people on how you communicate with them?
Sure. What I believe in is self-critic, and I also audit myself quarterly and see whether I'm improving.
Okay.
And I start at Texila over the year. I have seen a difference on how I interact with patients. But with the public health knowledge that I have, I'm now able to go further beyond the malaria. And you can see that patients do love that you are present where,
home happy
because they found a doctor who cares and who understands and who wants to know about the environment besides the disease.
I just want you to explain how you view public health as a career choice, especially to people who want to go ahead and study it and are maybe doubting or thinking, is it the right fit for me? How do you see it as a career choice?
Well, in the medical field, and to every doctor that is out there who would like to pursue, you getting a master's in public health doesn't restrict you to specialize in other fields. You could become a surgeon, but with a background of public health, you could become a pediatrician. I'm currently doing veterinary medicine, but who have a public health specialist background as well. So that just enriches your skill. It also enriches your knowledge base and also how you see the world in a different perspective.
Thank you very much for this interview.
Thanks to Texila American University for giving me this platform. I would like to say to every professional out there, including myself, that Texila is the way to go if you want to upgrade on your academics wherever you are. I have colleagues in different parts of the country, so every time you want to improve on individual development, think Texila.